My name is Danielle Iso, and I'm the Assistant Director at the Center for Autism and Related Disabilities at the University of Florida. I've been working in the field of autism for 25 years. My background is in special education, and I'm also a board-certified behavior analyst. I'd like to say anyone could benefit. It's really a person who has either a professional or personal interest in autism and who wants to learn more. I think what's exciting about the program is that we have taken into account the fact that we could have an audience that's very varied. We could have people in the medical field or in the health science, other health science fields, or in education or related services. We can also have, as I said earlier, employees, employers, and family members. Anyone who has a vested interest in autism and who wants to help make the lives of people with autism better. This program is unique in that it seeks to provide support to any individual who serves people with autism. So that might be clinicians, that might be teachers, that might be employers, even family members. I think the unique part of the program is that we seek to provide a very global instructional approach to understanding where autism comes from, how to utilize the strengths of autism, and how to support the needs of a person with autism throughout their lifespan. So one of the key factors of the courses is to understand where we think autism comes from, what autism looks like, and really understanding this notion of the autism spectrum, and why that makes it so difficult for autism to sometimes be diagnosed. That being said, I think that it's important that people understand that an individual with autism can look very different from another individual with autism. So it's really about doing your best to understand who that person is, what strengths they bring, and how we can best meet their needs. I want to encourage people who might not be sure that this program is right for them to consider it and really give it a try. I think that you have either encountered people with autism in your life or you haven't yet encountered people with autism in your life, but you will. And so I think it's really unique in that it gives people the opportunity to learn how to take the strategies and take the information that they gain from these courses and apply it in both professional and their personal lives. Although you do not need medical or science background, there is a biomedical course within our program. And I think that's really special and unique because it really does give learners the opportunity to think about the way that the brain creates what autism looks like on the outside. So we see how autism presents in the person, but it has so much to do with how much the brain is influencing that behavior and that person's communication. So our biomedical course does just that. I think anyone can benefit. The most important part is to have a passion and an interest about autism, but it certainly is helpful if there's a background in psychology, education, sociology, behavior, or any of the medical fields. But I think that we have taken into account in the development of these courses the fact that we could have people from a variety of fields. The most important thing is to have a passion and an interest. I think for teachers and therapists and other professionals in the classroom, the goal is to think about prevention. So what are the things that we can anticipate about individuals with autism and what their needs might be so that we can prevent any miscommunication, any breakdown of communication, and set them up for success. That involves things like being able to set up the classroom setting or the therapy setting in a way that's predictable. That includes providing repeated opportunities to practice important skills. And it includes being able to understand the communication behind any behavior that the individual or student is exhibiting. Yes, so I think it's important to keep in mind that a learner can learn in any environment given the right supports. And so we don't like to make the assumption that a certain learning environment is going to be better than another learning environment for that individual. It's really about harnessing the environment, making the most of the opportunities to learn, and definitely taking advantage of the typically developing peers that might be in that setting as well. It's nice to be affiliated with a University of Medicine or a College of Medicine because what it allows us to do is collaborate with people who see autism from a different perspective. but their perspective can then be complementary to the perspective that we have as clinicians in the therapy setting or in the classroom setting. So my course is Treatment and Intervention in Autism Spectrum Disorders. And the goal is really to provide the message that treatment is individualized, but it should all be based on evidence-based practices. And so throughout the course, students are introduced to a lot of evidence-based practices, and then we talk about what are the pros and cons of those practices. How do you decide how to individually implement practices that are specific to that individual? We talk about things like complementary therapies and how they are part of the program as a whole. We talk about behavior analysis and applied behavioral analytic practices. We talk about teaching strategies that are not just best practice for people with autism, but also for the general population as well, and how to make that work in the classroom or setting in which you are in.